Om Swastiastu, we are from SGD B2. Today we are going to present our student project presentations entitled Blood Glucose Monitoring During Vacations for Type 2 Diabetes on Oral Medications. But first, let me introduce our team. And here is the outline for our presentations today.
First, let me introduce myself. My name is Danisa Putrita with real SGD number 005, and today I'll read our student project introduction. So first, from the background, in 2021, IDF has showed that epidemiologically, about 537 million adults worldwide are living with diabetes, and approximately 98% of them are diagnosed with type 2 diabetes. Type 2 diabetes itself are associated with some of complication, but still, type 2 diabetes patient can still do traveling activity, but there are still a lot of extra things that need to be watched out, such as for the medication and blood glucose monitoring. Therefore, type 2 diabetes with oral medication need to consult with their doctor before traveling. Here's our formulation, and here is our purpose of this student project. So the benefit of this student project is, for the medical student and the public, we can understand more about type 2 diabetes, the purpose of blood glucose monitoring, and how can the type 2 diabetes patient use the blood glucose and their oral medication during vacation. So that's all for the introduction. Thank you.
Hello everyone, my name is Dea Kalista Andana Putri with the last 3-digit number of 129.
Type 2 diabetes mellitus is one of the most common metabolic disorders caused by hyperglycemia, which occur due to inadequate insulin secretion and the inability of insulin-sensitive tissues to respond appropriately to insulin. Organs involved in the development of T2DM are pancreatic cells, adipose tissue, gastrointestinal, liver, skeletal muscle, kidney, and brain. T2DM is multifactorial, which is a combination of genetic, metabolic, and environmental factors.
My name is Kedara Devaranjaya, and the last 3 digits of my student ID is 075. Now, I would like to explain about the risk factor of type 2 diabetes. And before that, I would like to emphasize that the main etiology of type 2 diabetes is insulin resistance. So, any factors that associated to insulin resistance can be considered as the risk factor of type 2 diabetes. And according to Freeman and Pennings in 2022, these risk factors can be divided into acquired and genetic origins. The first one is the most common acquired risk factor, which is metabolic syndrome, that consists of obesity, atherogenic dyslipidemia, hyperglycemia, hypertension, prothrombotic state, and pro-inflammatory state. These factors are related to increased level of free fatty acid, increase of plasma cortisol levels via hypothalamic pituitary adrenal axis activation, and impaired glucose and insulin delivery, that are able to lead to impaired insulin sensitivity in various body tissues. Diabetes itself is one of the most common risk factors for cardiovascular disease due to damage at the macrovascular level. Therefore, when a person has a history of cardiovascular disease, clinical practitioner can raise suspicions that probably there's a type 2 diabetes disease that occurs but has not been detected clinically. On the genetic aspect, first-degree relative with type 2 diabetes history is related to impaired insulin sensitivity. Besides family matters, Hispanic, African American, and Asian ethnicities are reported to have a higher tendency to experience type 2 diabetes than other ethnicities.
Hello doctors and friends, my name is Christine Natalia with the 3 last digit student number, and now I'm going to present about signs and symptoms of type 2 diabetes. So, due to the chronic nature of the disease, many people ignore the signs and symptoms of diabetes. Unlike many other diseases, the effects of hyperglycemia are not immediate, so people do not consider this as a serious problem. People do not know that the damage can begin years before symptoms appear. This is unfortunate because early recognition of symptoms can control disease immediately and prevent vascular complication. However, the classic signs and symptoms of type 2 diabetes are first, frequent urination, excessive thirst, unexplained weight loss, and acanthosis nigricans. Then there's a increase of hunger, malaise, slow wound healing, blurry vision and numbness or tingling, recurrent infection such as UTI and skin infection, and then impaired gingival healing. It is important to note that these symptoms can occur in both type 1 and type 2 diabetes. However, some people with type 2 diabetes have no symptom at first, or their symptoms are mild and go unnoticed for a long time. Those are from me. Thank you.
Hi, my name is Gwen Farshadan with student number 110, and let's talk about the diagnosis and differential diagnosis. To diagnose a patient with diabetes, diagnosis criteria must be applied, where the diagnosis criteria is created by Perkany, which entails as fasting plasma glucose is or more than 126, plasma glucose is or more than 200, random plasma glucose test is or more than 200, and also HbA1c level is or more than 65%, with which they have their own rules that must be applied. So for the diagnosis and differential diagnosis, especially for test HbA1c, it cannot be used as diagnosis tool or evaluation if the patient have anemia, hemoglobinopathy, history of blood transfusion in the last 2-3 months, anything that may influence red blood cell ages, and also kidney function. We can also use Fundamental 4 and Sacred 7 to further interview patient, and also differentiate type 1 and type 2 diabetes in patient, where type 2 is usually older and correlates more with overweight and obese. And in type 1, the autoantibodies presence is significantly higher, and in type 2, the C-peptide or UCPR is also higher. For the differential diagnosis, it's adult onset type 1 diabetes, type 3C diabetes, endocrinopathies, infection, intermediate hyperglycemia, hemochromatosis, disorders on the pancreas, metabolic syndrome, genetic aberrations in insulin action and beta cells, drug-induced signs and symptoms, and also malignancies on endocrine system.
My name is Diana Ningrum, and I will explain about the treatment. Conventional treatment of type 2 diabetes is insulin therapy, pharmacology, and improving lifestyle with diet and exercise. The main conventional drugs for treatment that are commonly used include sulfonylurea and alpha-glucosidase inhibitors. These drugs are usually given as monotherapy or in combination. Monotherapy in the treatment of type 2 diabetes has a target to reduce hemoglobin A1c, and metformin become the first-line agent of choice for monotherapy with hypoglycemic agent when metformin is contraindicated. When monotherapy cannot control glycemic parameter in patient, combination therapy with 2 or 3 drugs is recommended to achieve glycemic control so as to avoid B-cell damaging effect. Oral medication is also sometimes combined with insulin therapy.
Hello everyone, my name is Anna Agung Istiadaneni. With my last 3-digit ID student number is 233. Now I will explain about the complication of type 2 diabetes mellitus. Complication in type 2 diabetes mellitus can be divided into microvascular complication, macrovascular complication, and micro-macro complication. The first one is macrovascular complication, which is complication that attack large blood vessels. The example is peripheral arterial disease, is a complication that characterized by excessive arterial obstruction and reduced blood flow to the lower extremities. And coronary arterial disease that caused by blockages in the coronary artery. Next is microvascular complication, which is complication that attacks small blood vessels. The example is diabetic retinopathy that can cause retinal damage, and if not treated quickly, this disorder can lead to blindness. And peripheral neuropathy that occurs because blood sugar levels that are too high in the blood damage the blood vessel that supply blood to the nervous system. And the last one is micro-macro complication, and the example is diabetic foot. Maybe that's all I can say. For the next explanation will be explained by my friend. Thank you.
With the last 3 digits of student ID number. My name is Mustanja Trikira. With the last 3 digits of student ID number is 199. And today I will talk about the prognosis of diabetes. Diabetes is a long life disease and there is no definitive cure. The prognosis of type 2 diabetes depends on how well the patient treating and controls the blood sugar levels. Uncontrolled type 2 diabetes can cause serious health problems such as morbidity and mortality. Chronic hyperglycemia in diabetic patient can lead to microvascular problems and also an increased risk of atherosclerosis cardiovascular disease. However, The risk of cardiovascular disease can be reduced by taking statins, regular exercise, stabilizing blood pressure, and quitting smoking. Thank you.
My name is Stella Angeline Ispianto and my last 3 digits are 142, and now I will explain about the definition and purpose of blood glucose monitoring. So blood glucose monitoring is the use of glucose monitoring devices to observe patterns in the fluctuation of blood glucose levels that occur in response to diet, exercise, medication, and/or pathological processes that are linked to blood glucose fluctuations such as diabetes. And the purpose of blood glucose monitoring is to detect hypoglycemia and hyperglycemia and also plays a role in determining normal blood glucose level. And the second one is to help monitor diabetes medication effect on blood glucose level. And the third one is to help individuals with diabetes to track their blood glucose level to reach their treatment goals.
Let me introduce myself. My name is Jenny Jaya with the last 3 digits of student number is 037. Now let me continue the presentations with monitoring method options. So monitoring the blood glucose concentration is important in order to reach the glycemic target of each patient. Therefore, there are methods to monitor the blood glucose such as glycolated hemoglobin A1C levels test, self-monitoring of blood glucose, and continuous glucose monitoring system. I'll be explaining one by one. Starts from the HbA1c levels test. The HbA1c levels test is often considered as the gold standard in managing the type 2 diabetes mellitus, but this test is not suitable for daily monitoring because it needs laboratory requirements and the process is quite painful and has the risk of local tissue injury if done in high frequencies. This test can be done twice a year for controlled patients and 4 times a year for uncontrolled patients, or if the therapeutic methods needs to be changed. The next one is self-monitoring blood glucose. SMBG test requires a glucometer, a test strips, a blood from capillary, which can be obtained from pricking the fingertips or other alternative sites such as earlobe, forearm, or palm. SMGB can be done frequently within the same day, but the frequency still depends on the therapeutic strategy. And the next one is continuous glucose monitoring system. CGMS measures the glucose concentrations in the interstitial fluid. This test method will give us full report real-time glucose values. And this system works by implanting a sensor subcutaneously at the abdominal level. The glucose level will be evaluated every 5 minutes, so there will be 288 values recorded in one day. The data obtained then will be evaluated after it is visualized on computer using a software that will interpret the data into graphics. That's all for me, thank you.
Hello everyone, my name is Grace Valerie with the last 3-digit number of 143, and in this presentation I'm going to present about the oral pharmacology therapy. As of now, there are 10 classes of oral pharmacology therapy for type 2 diabetes mellitus, which are sulfonylureas, meglitinids, metformin, thiazolidinediones, alpha-glucose inhibitors, sodium glucose transport protein 2 inhibitors, dopamine agonists, dipeptyl peptidase 4 inhibitors, oral glucagon-like peptide 1 receptor antagonists, as well as bile acid sequestrants. Each class works in a different sites of action like insulin secretion, glucagon secretion, appetite control, neurotransmitter dysfunction, glucose reabsorption, glucose uptake and utilization, lipotoxicity, hepatic glucose output, as well as gastrointestinal. Each also has their own advantages and disadvantages regarding lowering glucose levels, lowering risk of hypoglycemia, weight loss, lesser effect on AS, CVD, CHF, and renal failure. That's all from me. Thank you.
My name is Evany Iglesia, and the last 3 digits of my student ID number being 127. Now I'm going to be explaining about the travel medicine aspect in type 2 diabetes. Alterations in sleep duration, meal intake, physical activities, and medication schedules affect blood glucose levels. Therefore, diabetic travelers should adjust their medication dose to prevent from diabetes acute complications. Currently, there is no specific guideline for diabetic travelers, but pre-travel consultation is highly recommended. During the consultation traveling date, itinerary, activities, mode of travel, and traveling reason will be assessed carefully. Then, medication dose will be adjusted and the patient will be given education during the travel.
My name is Josephine Adela with the last 3 digits of ID number is 094. The conclusion is type 2 diabetes mellitus or T2DM is a heterogeneous metabolic disorder which is caused by inadequate insulin secretion or the resistance of insulin. resulting hyperglycemia in patients with T2DM. Risk factors of T2DM include metabolic syndrome, obesity, first degree relative to T2DM, aging, ethnicity, and cardiovascular disease. Signs and symptoms of T2DM include frequent urination, excessive thirst, unexplained weight loss, etc. T2DM diagnosed according to the last guideline from Indonesia Endocrinology Association or PERCANI with some diagnosis criteria. T2DM treatment include insulin therapy, pharmacology, and modification lifestyle with diet and improved physical activity. T2DM can cause complications such as microvascular complication and macrovascular complication and other complications like diabetic foot. The prognosis of T2DM depends on how patient can manage the blood sugar. There is a possibility of the development of several cardiovascular disease. Blood glucose monitoring are an indicator to determine diagnosis of DM, and it can be reference for determining treatment and therapy for each patient to reach their treatment goals. Some tests for measuring blood glucose levels are glycated hemoglobin A1C or HbA1c test, self-monitoring of blood glucose, and continuous glucose monitoring system. After monitoring and testing blood glucose level, patient will be given some pharmacotherapy. Patient with history traveling has some different level of blood glucose based on traveling activity that can easily cause hypoglycemia and hyperglycemia. That's all from me. Thank you.
So that's all about our presentations about blood glucose monitoring during vacations for type 2 diabetes on oral medications. We do apologize for any mistakes during the presentations. Thank you for your attention. I'll close the presentations with Paramesanti. Om Santi 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 Om.